My first knee surgery was October of 2006. Before then I was having a lot of pain, and my MRI showed that I had a torn meniscus and a Baker's cyst. So I had that surgery in 2006 by Dr. McNese, and I had complications from that surgery. My knee swelled up, I caught an infection, I had to have fluid removed. I was off work for 2 months for that procedure. And then I thought it was okay. I went back to work, and the pain persists. It kept on again. So 6 months later, we did another MRI, and it showed that I still had a torn meniscus. So I went back to surgery, and I had the second arthroscopic surgery. June of 2008, I had a really, really bad fall. Finally, I got another MRI in late 2008. And I was told that I need to have a partial knee replacement. And he suggested that I get a partial knee replacement on the lateral because the inside of the knee looked good, but because of the arthritis, the outside was totally gone.
I see.
And he suggested that I do the partial because of my age, and it should last me 25 years. The surgery went well. I recovered good, but I always had a pulling sensation, seemed like. And then it started the creeping sound, like something was loose or I was just moving in there. It just, when I walk, it just, you could just hear it.
Really?
Yeah, and it would even pop. It would just pop real loud. So, you know, I don't know what to do at this point because I'm feeling like a hypochondriac because I keep going back with the same knee. So you just said something interesting. You almost blamed yourself. Yeah, because I'm not, because I'm still complaining about this knee because it's supposed to be fixed, right? Right. The partial knee was tilted, like cockeyed, I don't know what you call it medically. And it needed to be removed. So now I'm scared to death because this should have lasted 25 years and now we got to take it out. What concerned me was when I got up to use the walker, I wasn't able to pivot. I couldn't take off, make a step. In May, when he just said he didn't know what else to do. And I said, well, there's something that has to be done. So I need to seek some more help. It was just crooked, and I couldn't walk. I was just totally knocked knee from the right knee. So that's when we submitted an authorization for a second opinion to find a revision. And I had an option of you or Dr. Andrew Spencer and Dr. Graham and Dr. Mitchell recommended you.
I see.
Dr. William Long.
You've had 7 months or so. What has changed, or when did you first notice that things were better, and then what's happened since then? What are some things you could share with us?
I noticed there was a difference the day when the therapist got me up post-op in the hospital. I could actually stand up and take a step and walk. And I didn't feel all crooked and off balance. That was the day I noticed. I was like, I have arrived. I'm not afraid to walk out in my yard, in my backyard. And, you know, I can water my lawn. I can go to a concert. I mean, I go with cautions and I watch my steps. I try not to be in the middle of crowds, but stuff like that I didn't do. I just feel that if you feel like something is wrong, you should seek help, find a second opinion. Because there's help out there. There's always somebody that can help you. Don't give up. Don't accept. And if you get a bad job or you feel like you got a bad surgery or whatever, there's always somebody else that can do better. I mean, there's help. You just got to seek it. That's my story. And when I see patients and they're looking funny, I tell them about Dr. William Long. I really do.